Today's guest is Joel Joy, co-founder of Patient Voice. Patient Voice is a platform that works to ensure patient insights are meaningfully integrated into health technology assessment, policy, and care decision-making. Through tools like voice transcriptions, real-time insights, and case note summaries, Patient Voice helps clinicians save time, engage patients, and improve efficiency. Joel is here to tell us more about it. So Joel, welcome to ROI from AI.
Great to be here.
Excellent. Thank you so much for coming. I did give a brief elevator pitch there, Patient Voice, but for those unaware of the work that you do, can you give us a bit of a deeper dive into Patient Voice and the problem you're trying to solve with it?
Yeah, so essentially it started with my wife. So my wife is a school counselor at a high school, and we've, I found that she was always taking her work home and spending a lot of time doing detailed notes because there's like legal requirements to have those detailed notes in case it gets subpoenaed, and she's very particular about getting everything accurate and consistent and in the format that she likes. But because it was taking a lot of time, I thought, there must be a better solution to her problem where that she's taking the time to do these notes in an accurate and consistent way. But also, like, it's hard to remember details after an appointment. So, over a weekend, me and my co-founder, Tom, decided to try and wire something together to see if we can help her. And that's how Patient Voice was born. And we quickly realized after that it wasn't just her having that problem. It was pretty much everyone in the healthcare industry. Everyone's time constrained, a lot of time pressure, accurate notes are critical. And there were gaps in care that came from not having accurate notes, especially when passing to other providers or just like general documentation.
Yeah, I love that it was born out of this real world situation. I'm sure your wife was very happy that
Yeah.
you created a business out of one of her problems. And I do know that people say doctors have bad handwriting because they're taking so much note taking, and there is a lot of information. Outside of your wife's work, what are some of these use cases that you've seen and real world examples of Patient Voice and how it's been adopted?
Yeah, so we've got a few GP clinics using it, some allied health professionals, osteos, counselors, school counselors, psychologists sort of using it. Now, each of those professions have varying lengths of appointments. So, for example, GPs would be like six to 10 minutes, whereas a psychologist would be like an hour. Now, it will run in the background, so the clinician can sort of look the patient directly in the eye and focus on actual patient care. And then at the end of the appointment, it's completely transcribed all of the conversation very accurately. Occasionally it makes some mistakes, but generally it's 99% accurate. And then it will just generate their detailed note immediately after, so within 5 to 10 seconds, which normally, from anecdotally from my wife's experience, after a 1 hour appointment with a student, it would be an half an hour to an hour spent writing notes, whereas now it is 2 to 5 minutes after transcription and notes just to edit it or make it the way they want. And that's a huge save in time. So the amount of time saved varies depending on the profession, but generally, significantly reduces the documentation time. So they can then spend their time either seeing more patients, going home early, saving that time to do something else, or whatever they want to do with that free time. Actually,
Well, you mentioned it there. Time saved is obviously one of the key metrics of success. What are these other metrics of success that you're using to make sure Patient Voice is being implemented and then effective? Is it just time saving, productivity? How are you measuring success of the platform?
yeah. So various things. So the time saved is the biggest one. So our users report they save around on average 5 to 10 hours per week. But it's also around what are the other and that's just on case notes, right? What are the other daily things that they do that we can save time on? Which is like generating letters, like patient letters, referral letters, medical certificates, and then we kind of want not just stick to that. We want to go even further. So what are some follow-up questions we could ask as a healthcare practitioner? Or what are some resources that I can refer to based on the appointment? So we surface that as well. And even like short summaries, and we have like a whole suite of analytics. So our pro users and enterprise users have access to analytics. So if you're a practice manager, they might want to be like, all right, well, there are all these practitioners using it. What are the main presenting concerns happening? What time of the year? And how can I run my practice better armed with that information? So we want to give them that information so they can be like, all right, at this time of the year, there's a lot of these type of concerns. So we might need to get a specialist in, or a GP in, or a psychologist in who specializes in that. Not having that information means you're kind of just having a stab in the dark. But we give that information so that they can then say, all right, this is what's happening in my practice. So then I can manage it better and hire the best staff and address the concerns of my clinic.
So is patient voice interpreting this data and coming up with language-based solutions, or at this stage, is it up to the clinician to interpret the data?
It's up to the clinicians to interpret the data. We will sort of move in the future towards providing insights at a patient level as well as like a clinic level. That's something we're actively working on. But yeah, at the moment, the data's there. So they can say like, well, at this time of the year, those patients are presenting with these concerns. So you could infer a trend from that, right? About the shortcomings of your clinic, or improvements, or things that you're doing well.
Yeah, amazing. I could imagine as well in some of these more traditional roles, being a doctor or any type of clinician, very traditional and very tried and true.
Yeah.
I could imagine there's this reticence to adopting this new technology, especially with the image that's around AI at the moment. It's a little bit scary for a lot of people. Have you noticed some hesitance to adopting this sort of technology, and how are you tackling that?
Yeah, definitely. A few sort of not oppositions, but yeah, hesitancy, as you said. One is around privacy and security. So obviously, there's audio being transcribed. Um, what's happening to that audio, or the case notes that are generated? What's happening to that? So we built it initially, and we still stand by that principle of privacy. So we, as the founders and the maintainers of this app, we can't see any of the data. So we basically store everything on the browser on local storage, so that everything that sits there, it's completely encrypted as well. Um, the only way to be able to access data is to be able to log in to the application. So we can't see what's being generated. And yeah, that's the way we sort of address that. And then, things like security and compliance, making sure that our back end and front end have security in mind always, and then there's no chance of any data leakage. We've made that the number one priority. The other thing, hesitancy is generally just around AI. And people say like, oh, it's going to replace our jobs. Um, it's going to replace my profession. And to be perfectly honest, I'm a little bit of an AI skeptic. And I think you can only approach building a company like this by being a bit of a skeptic and understanding its shortcomings. So when we speak to customers, we say, um, AI will not replace your job, but it will make your life a little bit easier. Because the reason healthcare workers went into the industry generally, I don't want to generalize, but mostly is for patient care. They're very empathetic, want to help patients, and a lot of the roles have now become more about admin and legal requirements and making sure everything's documented properly. And while patient voice doesn't address all of those things, it addresses some of those things, which is the things that they do in appointments day to day that, each time, takes up minutes and minutes and hours that we're going to address. So their hesitance is AI going to take over my job? And our response is no, we want you to just do the thing that you signed up for and not spend time on the things that you didn't sign up for, which is all the admin and all the overheads associated with that.
Yeah, I tend to agree. Hosting this podcast has shifted my perspective on AI. I initially came into this project very skeptical as well as an artist and a creative, and I've seen generative AI and I've seen AI podcast hosts even, but interviewing people like yourself that are increasing productivity and removing a lot of this administrative laborious work actually makes us more human. And this is one thing I've said in almost every podcast is if we have more time to be human, then we actually get more time to have fun and to explore our interests and have hobbies, spend time with family. So the work that you're doing, I think, is really amazing, even though you're in these early stages. But I'd love to know, where do you see patient voice evolving within the next 5 years? Can you reveal any ambitions you might have?
Yeah, we've got big ambitions. So one of the things that we sort of heard from friends and family is that they like we've given them a free account just to try it out and to give us feedback, and most of them are healthcare workers. But one of the things is they've started using it for their own personal appointments, to be able to, like, say they might go in with a parent who can't speak English, or they want to be able to document their own health journey, visiting specialists and GPs and psychologists and so on. So one of the things that we've been working on is the patient side of things. So how can a patient track their own appointments in a very similar way, and not miss any information. And then, like, imagine if you were a patient and you go to a new doctor or a specialist, and instead of them having to go through the electronic health records or my health record, you can just on an app just be like, send it to this specialist, and they'll have a summary of everything. Um, I think that'd be very powerful. On top of that, like on the healthcare side, um, having like patients appointments over time. So not just what appointment by appointment, but multiple appointments over time. That then you might be able to infer trends, or detect risks to certain things, or have an idea of maybe they've taken some medication before. They've mentioned this. Could that be the reason that any new presenting concerns might have happened? So just sort of like nudging them towards being a bit more proactive rather than preventative. I think it will be very, very powerful. And you know, uh, I'm sure there have been many horror stories that you've heard, but like I've heard some stories about people who go to the doctor, and the doctor's busy. Like, it's not their fault. Like, they just need to sort of keep seeing patients, but they'll be like, oh well, it's not a big deal, or um, come back later, or you know, um, they haven't really had the chance to delve in to sort of understand what's going on. So if
Mm.
you could know that quickly in advance without having to ask the same questions over and over again, um, in different appointments, then you can just sort of get to the crux of the issue um, quickly, rather than the patient having to go multiple times, and then there's like missing information, things like that. So I'm very sort of ambitious and hopeful. We can drive that side a bit more. Yeah.
No, it's exciting. Such an exciting space as well. Health tech is really, over the past 2 to 3 years, just exploded. And I'm sure there's a lot of people that would love to be in your current position where you've got this thriving company and there's a really exciting future. For those people who have their idea and it's at zero and they want to take it to one, what would be one of your biggest pieces of advice you'd give to someone that's looking at where you're at and wanting to take their idea from zero to one?
These days, there are a lot of like AI coding tools and vibe coding tools, and those things have helped to accelerate getting from an idea into like a MVP, or into a working production ready app. But I mean, I would say not necessarily production ready app, but some way there. Um, I think it takes a little bit of grit, even with these tools sort of helping you save time to build. You kind of need to understand how infrastructure works. What are the common concerns within the industry, and how can you address that through tech? Um, and I think it's just a lot of conversations, a lot of conversations with people within the industry. And yeah, I'd say, like, you should try and solve a problem. So be clear about the problem that you're solving, and what the impact is. And that's the one, it's like a motivating factor to be like, well, people are relying on this to be able to save time or save money or things like that. So if you have that purpose and that impact in your head clearly, it helps you go through the tough times a little bit, because it's not easy. Like, even with all these tools, it's not easy. And there are obviously like many other aspects of running a business, like sales and operations and billing, and how you work with the team. So I guess the overall advice would be, get ready to sort of dig into all of it, especially if you're a founder. And yeah, like a lot of it is just about managing relationships and leaning on experts, and sort of leveraging not just your skills, but other people's skills to bring your idea to reality. Yeah, that's probably what I would say. It's a long-winded answer, but that's
No, I love it. And it leads me to my last question, which is a question I ask every single guest. And if you could condense it into something simple that we could all take home, that would be amazing. It is, what is your biggest tip for a return on investment using AI?
okay. So there are tools like ChatGPT and Claude and things like that that are extremely powerful on their own. So learn how to use and prompt them properly. And then there are existing tools that sort of leverage that technology, but in a more like honed in way to your industry. So my biggest tip would be, try it all out. Try it all out. See what works for you and what doesn't, because it's an evolving field. Things are changing very quickly. So try it. If it fails, try again later on. But try everything until you get to that spot where you feel like it will save you a bunch of time. And that's where the return on investment will be, which is time saved.
Yeah. Time is money,
Yeah.
as I
Yeah.
say.
Yeah.
Well, Joel, it's amazing to see the work that you've done. And even though you're in the early stages, you're having a real world impact using AI. It's very inspiring work. And I'm excited to see where it's going to take you. So thank you so much for joining us on ROI from AI.
Awesome. Thank you so much.